Welcome to Make America Healthy Again. Join Dr. Charles Antinori and friends as they share solutions, tips, and insights that only doctors know for creating better health. Here's Dr. Antinori.
This is the Make America Healthy Again podcast. I'm Dr. Charles Antinori. My guest today is my good friend, Olga Russell, who's attending in radiation oncology at Cleveland Clinic now. She's going to talk a little bit about her background. But I want to mention that she's the one I mentioned as my friend on page 13 or around there in the book, talking about the friend who did nursing for 9 years and then went to medical school. And as I said, she's just finished residency in radiation oncology and is working in the Cleveland Clinic now. So, hey, Olga, you want to go over and give us a little bit of your background, Olga?
Sure. Hi, everyone. Thank you so much for inviting me to this podcast. I'm Olga Russell. I'm a radiation oncologist. I'm a former nurse and a mom. And today I just want to share my story, background, and challenges that came along during my journey. I grew up in Russia, in a small town near Siberia. And during my last college year, I was provided opportunity to travel abroad. And since 2007, I've been here, and I started my career as a nursing. And it's been challenging, but having background as a nurse shaped me as a doctor, and it taught me a lot that I feel that it's very useful and very appreciated by patients when I incorporate my background into patient care.
Absolutely, right. We're 9 years in the neonatal ICU, right?
Yes, I started as a nurse, as a NICU nurse, and during work night shift hours, I also started my medical school. So I was too ambitious. So I started working as a nurse on the weekend and night shift. And I was a first year medical school student. And during my night shift, I was trying to make study material, flashcards, and providing bedside care for newborns who sometimes were less than a pound weight and required a lot of support, a lot of lines, tube, calculation of TPN, nutrition, and staying awake during night shift, and learning medicine and learning all the new subjects and being a medical student. That was challenging. I don't know how I did it back then, but I'm glad it's all worked out.
You were a mom at that time too, right? Already?
Yes. So on top of everything, so I managed to have a baby. I planned to have it between exams and working and before my clinical rotations. So in that tight window, I have my beautiful baby girl, and becoming a mom was also a big part of to become resilient, to become a doctor who I am now, and be patient and provide for family and support my family equally, to be present and be present at work. So it's a balance. And I believe that nowadays it's really challenging for women in medicine to balance life and work and to be present 100% for all your patients, and at the same time to be a mother, to do homework, to cook meals, to prepare lunch boxes, make sure everyone is tucked in at night. And so I admire every woman in medicine.
Yeah. We talked about it when I started out a long time ago. It was 19 69 actually. When I started Dartmouth Medical School, there were like 50 men in the class and 5 women. But now the medical school is, I think it's slightly more women than men actually in medical school now, like 51-49, something like that. So it's been a big change. And again, speaking as a guy who was a surgical attending, surgery was like one of the last places that women sort of infiltrated. But I found, that they turn out to be, great surgeons. They really do. And, when you're growing up, you kind of think you'd see somebody with like big hands and people would say like, oh, big hands, he'll be a good surgeon. The reality is small hands is better to make you a good surgeon,
I
And
agree. I
it's a
agree.
small, and nowadays they're using no hands because it's more robotic and laparoscopic. But
Yes, that's true. And the amount of sacrifice that women do when they decide to elect to go into this career. When personally I made a choice to go to medicine, I knew that I'm going to leave my stable job as a nurse for years of uncertainty and knowing that it would require a lot of debt that I would gain from being in medical school and residency. That is another challenge that I think a lot of young doctors, residents face.
yeah, well, that's what I pointed out in the paragraph. But the other thing I wanted to mention about you in the book is that you also helped me with some of the research on the book. But that's the thing I pointed out is that successful nurse, you can, especially for raising a family, you have much better control of your time in nursing. You can to a certain extent control your shifts and that sort of thing. And when it comes to try to raising a family and all that, it's a lot easier with nursing. And then
Absolutely.
the big fact with nursing, you're making a pretty good living. It's not great money. I mean, it's not like a ball player or anything, but you're making a decent living. Whereas you go to medical school and you end up with a tremendous amount of debt in most cases.
Yes, I agree absolutely. I've been asked many times, why did I do that? And I'm thinking myself, why? I had a very comfortable schedule, working 3 days on, 4 days off. I can take vacation days without thinking ahead of how to plan and how to manage my patients. So it is very family friendly in Korea. And as a doctor, I don't have as much luxury of freedom of your schedule. I feel like I have much less of freedom to plan vacation or plan something that I need to think about. Oh, if it's this week, I'm going to be on call, or if this week I have a new consult, or I have a lot of patient schedules on this week. So it's the less of flexibility um, makes this career challenging, but at the same time, it's very rewarding, and
Yeah,
it's very rewarding career, and just requires a lot of resilience, patience, and hard work.
yeah. That's the way I felt about the career in surgery too. Is you sacrifice a lot of your time, but the work itself is interesting and very rewarding because luckily 98+% of your people do well, and that part is very, very rewarding. But the downside, like we talked about before, is that speaking again from I know your experience was similar, but all of my surgical residents, they were all 250 to $300,000 in debt after medical school, and it's going to take it takes time, for that to go away. Whereas nursing school or even business school or anything like that, you can finish, right after college at 21, 22, or a couple of years of business school or a couple of years of law school and be 23, 24, 25 years old and go out and start making money and by and large have your weekends off and start putting money in pension plans and things like that. Whereas with the 4 years of medical school and then, in most cases, like your case, 5 years of residency, By the time you get done with all that, even if you don't take any time off, you're in your early or mid 30s, before you finish anything, as opposed to
Absolutely.
nursing school and these other schools where you can start
Right.
teaching, where you can, start your career at 10 years earlier easily,
Right.
and have,
Exactly.
much more time for family and work-life balance,
Absolutely. When now I see my paycheck, I almost don't see it because half of it going to my school debts, and I'm sure a lot of residents graduating with this amount of debt that would require years to pay off,
Right,
and it's not easy. So you remain humble, remain in this position for a long time, even after completing residency.
right. It
Especially, especially with the cost of living as it rising disproportionately, the salary is not changing.
Right. Yeah, I mentioned it in a book, and it's been a while, so I'm forgetting the numbers, but like basically the cost of living in Medicare, Social Security, the Social Security cost of living increases over the last 20 years have been something like 54% total, The medical reimbursement, doctors reimbursement during that same period of time has gone up like 5%. So basically, in that last 20 years or so, you've lost 45% of buying power,
Right.
and the doctors aren't the only one like that. I mean, a lot of fields that people talk about it all the time. There are just a lot of fields, that where, wages have not kept up with the cost of inflation in an awful lot of fields. Mm. And we were
Absolutely.
talking about the concept, what solutions for all of this. One of them that I just read recently was making medical school 3 years, which would save, like around $100,000 on the actual cost of medical school, and would give you one more year of earning money. So the article was saying it would be like about a $200,000 difference, in what you come in the amount of debt that you come out with, you know.
That would be interesting to see if that eventually happens, but that's an interesting, good idea.
Yeah, I really think when thinking about it as I was reading the article, I was saying, it really, because I've been saying they have to do something, and you can't really shorten residencies, because there's just so much to learn, and it's just, in each field. Like I really wouldn't, even though surgical residents, and I did, 5 years of general surgery and 2 years of thoracic and cardiac surgery, I don't think it could have been shortened very much. But when I think about it, the fourth year medical school, and this article talked about it, you do some sub internships and things like that, but that might be the simplest thing to cut. And the other obvious one was, well, I did college in 3 years, but I really did kind of four, but I did like a whole semester in summer school, and then just I had some advanced placement, and I took a few extra credits. But I think truncating college or high school or anything like that, the people would come out even less well-rounded. The doctors would be less well-rounded than they are now. So I'm not sure that is a really good solution. Yeah.
Yeah, it's a tough balance,
Yeah.
but definitely future changes may benefit the.
Right. Something needs to be done is really the other thing that's going on, the guy Langone, we've talked about the guy, I think, Mr. Langone, I think he was from Home Depot, gave a lot of money, I forget, $1 billion or something like that, to the NYU Medical School, so that nobody's paying tuition at NYU Medical School. It must have been something big. Apparently, they told the first year that they did it for, which is about, I guess, probably 4 or 5 years ago now. They apparently told, they had their like white coat ceremony, and he came in and told them they weren't going to have to pay for medical school. So you can imagine how
Mhm.
happy those guys were. They went in thinking they were going to have a tuition
Um,
was probably, I don't know, 50, 60, $70,000 a year at that time. And all of a sudden it went to zero. But,
I
but,
certainly would be happy for
yeah,
sure.
pretty happy. Right.
Mhm.
Uh, but, the other side of that though is that even there, and most of your medical schools are in like large urban areas like NYU's in, lower Manhattan. Just to live anywhere near there, I doubt you could do it for less than $30,000 or $40,000 a year, just the cost of living, in that, eating and getting a hotel, lodging, in that area. And that's probably true. Most of your medical schools are in the big cities by and large. So it's even if tuition is nothing, it's not like it's going to be free, but it'd certainly be a lot less than the tuition. I think the average private school tuition now is like $60,000-$70,000 a year, and state schools maybe $50,000 a year, something like that. It's an awful lot of money.
It certainly sounds like it's not as glamorous field as everyone think. As I was not born here, so I have no experience to compare with. But sounds like it's not as appealing as it used to be, and glamorous field that people think about. It requires more investment, more sacrifice, and definitely be passionate about this career, because there are sure enough of challenges on the way. Mm-hmm.
One of the best stories about that for me was when I first started out. One of my first partners, a Jewish guy, and he's married, and they had a couple. They had two really young kids at the time, a boy and a girl. They were like 2 or 3 years old, and went over his house for dinner one time when we first got to work together. We worked together for a few years, and I met his wife and these two little kids, and and they were doing great. At that, he was a surgeon, so at that time it was like the best thing. The money was really pretty good, and we were very, very successful. And then 20 years go by, and he's telling me the story about his daughter, who now was like 22, 23 years old, something like that, and she was wanted to get married. The guy she wanted to marry was a pediatrician, and she was telling my friend and his wife, Dad, I really love this guy, but if I marry him, we're going to be in debt for the rest of our lives. It's amazing how it sort of changed in like a 20-year period, basically. Kind of funny.
Right.
Yeah, but again, it is. I mean, the work is very satisfying, and they'll do something. Looking through, what was I looking at? Oh, things about different medical. So I think it was we look at the best medical schools or something like that, and all of them seem to be making a big effort. And I'm sure it's because of NYU. It's because the NYU all of a sudden is free, and all of a sudden becomes like the hardest medical school to get into. All of the medical schools are I think hitting up their donors to try to really get some money so that they can reduce their tuition, like subsidize the tuition, if not completely, at least bring it way down, so that they can, attract people. Because I think they're realizing that this has just getting unsustainable when people are coming out with 200, 300, 250, 300 and more $1,000 worth of debt,
Yes, and when I talk to my friends back in Russia, they doctors or other professionals, they don't understand. They most of my friends who graduated from school, medical school, business school, no one has the amount of student loans Americans have, or most of the education is free, and so this. Was surprised for my friends to hear that by the time I become a doctor, I acquire so much debt, almost a cost of a big house here.
Right.
So,
Right. It is a relatively new thing. Like I said, when I went through, it was you ended up with debt, but I mean, I think I came out with $6,500 worth of debt, at the end of medical school. You're talking about other countries, though. I just finished that book, Which Country Has the Best Healthcare System, by this guy, Ezekiel Emanuel. And he went around. He didn't talk about Russia. I know that doctors don't make much money there. But China, they definitely don't. It's a very low paying specialty in China. Some of the civilized countries in Europe, they do okay, but on average, the doctors in the United States, are better paid than pretty much any other group of doctors. A few of them are close. I think Switzerland, is the closest, and some of the Scandinavian countries are pretty close to what they make. But the other thing about that was interesting about that book is that they all have a huge percentage of, like 50% of the doctors are basically family practitioners or primary care, and they are the gatekeepers, for the whole system, which again was pretty much the way it was until the 1970s in the United States, but there weren't nearly all that many specialists around. And that was as we were talking about back in the 1970s, the amount of money that the United States spent on medical care as a percentage of the gross national product was similar to the European countries. I mean, we were all clustered in around 8%. And then starting from there, somehow or other, the United States just went up and up, and the European countries went up, but not nearly as much. Most of them are clustered in the 8 to 12. I think Switzerland's like 12%. That's the closest to the United States in terms of the gross national product, percent of gross national product. And the United States has been around 18%. It's something changed, at that point. It so happens that that's right around the time Medicare got passed in 65, and I think Medicaid got passed a little bit later than that. I don't know if that was the big driver or what exactly drove the increase in the United States, but we definitely have pay a lot more for healthcare than anybody else. And it's not just the doctor's salaries that are driving that up there. The doctor's salaries are like a fairly small, I think, 20% or something like that of the whole healthcare expenditure.
Yes, as we are thinking about how we practice medicine, we not just practicing medicine, we also thinking about cost of each test we're ordering and how it contributes to the whole cost of medical care. So it also limit us as a doctors to just do our job and be a doctor and practitioner or specialist in certain areas. We, in the back of mind, thinking about that each test that needs to be evaluated, considered by insurance, if it approved or it necessary. So this also adds challenges to the system.
Right.
And the
Well, yeah, they
cost.
try. There's no question, as I talk about in the book, I think we do way more tests. That's one thing, and that really drives up the cost tremendously. The cost of the real cost of CAT scans is like the real cost is like $500 or $600. They charge more than that. The real cost of MRIs is like a couple $1,000. This and again, partly because of fear of litigation and everything. We probably order more of them than most countries, and then there's just a lot of other things. I was just reading about I don't even know how to say it right. Lecanemab. It's a medicine for Alzheimer's. Have you ever heard of that?
No,
It got approved. It's been shown. They look at the knots and things in the brain on PET scans and things, and they found that these medicines can make them go away. It cuts any amyloid deposits in the brain. This medicine, there's two of them. One of them is called something like lecanemab, and there's another one that came out after that. And they kind of decrease the amyloid deposits in the brain, which you see with Alzheimer's. So, but the problem is that they haven't really seen it correlate with like that much less Alzheimer's. The people don't seem to be all that much better, even though there are fewer of these amyloid deposits in the brain with the medication. And the medication is like $32,000 a year, which that isn't even super high when you think about it, but
Wow.
it's a lot of money. And to make it worse, that's just the cost of the medication. It's an infusion. One of them you get infused every 2 weeks. The other one you get infused every month. So you got to go in someplace for an IV infusion. And you have to have like periodic MRIs during the year to make sure that it's not, because apparently if you lyse the amyloid too fast, that can cause problems,
Wow.
So you have to check that,
Mhm.
you have to check that with MRIs. I just don't think a lot of countries are doing stuff like this, Uh, yeah,
So, yes, definitely. This what I learned going into medicine in this country, that we are lucky to have a lot of advanced technologies and research, and that not a lot of other places can offer.
right. Well, anyway, listen, I think we're getting near the time here. That was really good talking to you, Olga.
I was
Uh,
good talking to you too. Thank you so
yeah,
much for inviting.
yeah, it's great. We'll keep in touch, okay?
All right, see you. Bye.
See you. Thank you. Bye-bye.